All right, we're good.
Good. I'm glad we're good. All right. All right, I'm going to call the meeting of the Human Services Committee to order for March 4th, 2021. And I'd like to ask if there's any courtesy of the floor. Aileen, Linda, anybody out there, anything, any emails, texts, numbers? All right, I see a hand, but I'm just going to wait a second for the community. Nobody from the community? All right, well then I'll tentatively close public courtesy of the floor. And I think Mr. McClure wanted to say something under courtesy of the floor.
I do, just very quickly, Mr. Chairman. Thanks for indulging me. We're often talking about, in the context of politicians, when we're on the other side of crushing the pandemic, as we work so hard to do in Northampton County, there really will be no virus heroes. But the truth of the matter is, in the healthcare profession, there are many heroes. But my personal hero, who I don't think has songs sung enough about her, is Dr. Paige Van Wert, who you're going to hear from a little bit later in your meeting. She truly is my pandemic hero, and the work she's done, not just Gracedale, but for her patients in many of the long-term care facilities that she services. She is a hero. I preface my remarks with that because I owe my friend and my pandemic hero an apology. When I introduced to you, so I'm apologizing to Dr. Van Wert, who is sitting here. When I introduced to you the monoclonal antibody infusion therapy, I practiced that, which came to Gracedale. I talked about St. Luke's and advanced PIC, but I failed to mention that it was Dr. Van Wert who actually brought that treatment to Gracedale. So I apologize for that oversight, and I thank her very much for fighting to bring that, what I believe is a life-saving therapy, to Gracedale. Thanks for indulging me.
No problem. As it stands now, we're going to we're going to do a report on Gracedale, and then we're going to follow up with a report from Dr. Van Wert, and then the Gracedale volunteer coordinator is here as well. So why don't we go with our report for Gracedale? Hello? Uh-oh. All right. All right, you're muted. Yeah. You're muted. Okay.
There we go.
All right.
There we go. So what I'm first going to do is I'm going to talk about our recruitment efforts. And what I first want to do is to show the commercial that has been playing and continues to play,
Go ahead.
so that everybody can see it. All right. Unshare. Oh, thank
All right,
you.
I don't know. The sound on it broke up. I've seen the commercial. I don't know. Did ever? It came through great, except that it broke. The sound broke up as it was going on. Did others notice that? Yeah, for some reason. I don't know about the others. I've seen the commercial, in fact, quite a few times. I think it's very good. Did anyone else want to try and hear that again, or you're aware of it? If not, go ahead, Jen, just continue.
Okay, so I just wanted to talk about all the recruitment efforts we did. And obviously the commercial was tremendous because we've never done that before. Another thing we have done is the billboards. We've done them on 33 and 22, and we are currently going to do one in Nazareth to remind, everybody in Nazareth that we're here. We have job opportunities for them. We also started something just recently with the HR department. So nursing used to follow a lot of the nursing hires and see how they're doing, but we gave that to HR. So HR will be following all the new employees. And I can tell you it's been a great success. We just checked in on our new employees from January, and they overall overwhelmingly love the job. They love being with us. So that's great news to hear. We did just hire 2 ADONs. We have the international nurses that will hopefully be starting in April or May. This was part of the 3-prong approach we were going to do about a year ago, but unfortunately COVID took that away from us. So these nurses will be welcomed. We're going to hopefully convert them into full county employees when the time comes. We also have staff development working with local schools. A lot of the schools now, L-Tri-C, Lincoln Tech, and what was my other one? Falcon, all have been doing rotations at Gracedale. And what we do is our staff development team works with the seniors once they're done and tries to get them to come over on board. So we're looking to hope that's a success. We also have the part-time benefits that we're offering for employees. So those would be anybody working 30 hours a week will be entitled to receive some benefits for new hires. Those that have been here, I think there were about 21 people who will qualify from old staff, existing staff. We are also going to start offering full-time 12-hour shifts over the weekend, which will have benefits, and then we'll have part-time over the weekend, which will not have benefits, but they will both be 12-hour shifts. We have 7 hires for January. Unfortunately, we did lose 3 to they left county employment. A couple of those were retirements. So we've been posting positions on Indeed through CCAP with McKnight's Long-Term News and also PACA. So those are new items that we haven't tried before. And that's about it for now. And then I can go into the report when you're ready.
Up to now, any questions, or otherwise I'm going to let her get right into her report. All right, John Cusick.
Yeah, thanks for that update. Just as a follow-up, how many vacancies do we currently have?
So I can break it down into departments. Do you just want to do nursing?
No, that's fine. Departments is good.
So there's about 120 part-time positions for nursing. And
is that all 3, CNA, RN, LPN?
correct. And then for full-time, about 110 full-times. That's across all 3 shifts for nursing. Dietary, I have about 10 positions. Laundry, about 3. And housekeeping, I want to believe 8.
All right, I guess then a follow-up. A while back, we offered the CNA training paid. Is that working? How's that panning out?
So what we're doing now is we are funneling all new employees that come in to want to be a CNA into the 8-hour course. So we can train them on the 8-hour course and get them right to the units while we're in this state of grandfathering for the waiver that we received from CMS.
Okay. Just one last comment. I know that while the federal government continues to extend and enhance unemployment benefits, it does make it a challenge to hire people. So thank you for the information.
Thank you, sir.
All right, now I'll take anymore, just remember, she's going to give a report. So some things may be coming up in her report. Are there any other questions right now before she gets into her report? I'm sorry if I forgot your hand was up. If not, I'm just going to let her start her report and then we can ask questions. Okay, go ahead, get into your report.
All right, so on the first page, we can go into census for January, which was averaging about 527. Cost per resident day was 315 for January. Hours per care per day is the 2.95. We have the all-inclusive Medicare revenue rate at 466, with the room and board portion being 379. On the second page, it goes over the Gracedale finances. So we have January's monthly revenue at $5,159,917. Our expenses for January was $5,153,012. For 2021, the capital spending, again, spending is obviously, we look for the infectious control issues. If there are any, we remedy them right away. But it's the necessary building improvements, the training aids for staff education, and any improvements. That should actually be the January admissions and discharges on the next page.
Yes.
So we have 22 admissions. There were 206 inquiries. And you can see how the discharges wrap up at the bottom. There were 2 to the hospital, 13 to community, 2 hospice discharges, and then unfortunately we lost 24 residents. So a total of 41 discharges. And then we have the COVID-19, the Gracedale stats. You can see our residents, since the beginning, there have been 419 that have tested positive. We currently just have 1 resident who's positive. We have 5 pending lab results. We have 313 that have resolved, and unfortunately, we have lost 97. Total employees that have tested positive have been 154. Results pending is 1, and right now we have no positive employees. You can see the DOH stats right in the next column. Those are the numbers that they've been reporting daily. And on the last page, it goes over our vaccine data. Since we finished up all the clinics, we had 87% of our residents vaccinated. 48 of our own staff have been vaccinated, and 21 volunteers have been fully vaccinated with 2 doses.
So it's 3% of our staff and then 48%. So are we looking at 51%?
Well, that was, so that 3% of the staff they only received the first dose.
One. All right,
and
so
they changed their mind.
we're within at least a couple weeks of having over half at this point.
Correct.
Okay. All right, well, thank you. Is there anything else you wanted to say before I open it up?
Nope.
Okay, questions? Mr. Myers?
Just, are we still set up for one floor for COVID?
Correct, we are. And we're actually doing improvements on that floor so that we can get rid of the portable negative air pressure machines, and we're going to be able to be self-sustained without them.
So we won't need a negative pressure at all?
It's going to be already built into our own system, so we won't need the portables.
Very good, thank you.
Any other questions? Lori, Ms. Vargo Hefner.
Hi, we're like I guess this is year 1 full complete of the new funding system.
Mhm.
Do we have any observations about how we've done overall under the new model?
Oh, as far as the new, the payment method, the PDPM?
Yes,
I'll let Brian talk about that.
I just wanted to see Brian, that's all.
So in reference to the new Medicare payment, PDPM, we did see a slight increase, obviously. You have to say that part of that was attributed to the COVID-19 coding, which was allowed for skilling. So we did see a benefit to the new system. And as far as the new payment system with the CHC for the state Medicaid system, essentially our rates were pretty much the same as they were when the program was administered by the state. So as far as our room and board payouts through CHC, that kind of was just kind of across the board the same.
And a follow-up to what you just said, so the COVID-19 coding will continue to be allowed, obviously, correct?
Correct. They've actually updated the ICD-10 coding to now permanently include COVID-19 coding.
Thank you, Brian.
You're welcome.
All right, Jen, you're still there? Hi.
Yes, I am.
I have a question. I was talking to someone and I just wanted this, you can clarify this because I think it's important. Your facility, like any other facility like yours, private or public, like the prison, like juvenile detention, it's a 24/7 operation. So when somebody comes in for a job, before they sign on the dotted line, they are fully aware of the mandation policy that at Gracedale. Would that be correct?
Absolutely.
It's explained to them very clearly.
Right. And they're also given a contract for whichever union they belong to. Yes, everything is spelled out.
Okay, good. I mean, I know that's done everywhere. That's a long-term care facilities as well as prisons and any 24/7 operation. But I just wanted you to say it because I think it's important that some people don't understand that outside of your industry. That has always been the case, and I don't see it ever changing. So good. Now I see with the vaccinations, we're inching up as staff. Are you seeing then a change in outlook by staff now that some time has gone by and some of us seasoned citizens have been getting the shots and we're still walking around? So is there are people warming up to it? Let's put it that way.
They are. Unfortunately, we have ended our first round. So what happens is we're waiting to see how the government is going to work with our pharmacies to allow us to get supplemental vaccines so that we can administer to new admits, to new hires. And, I don't know when, they're looking at how long these vaccines are going to be useful, but we're already working with our pharmacy to be ready when DOH and CMS release when they can obtain it.
Yeah, excuse me. I just clarify on that. And this may come up as a question. I see your hand. Jen, so what you're saying is, and you have to excuse me if I'm being slow on this. So now that we went through the first round, you still have frontline staff. I mean, that I would think would be a high priority. And the residents, by all means, are you like on just a regular list now? Since we went through it once, now you've sort of been pushed on to so I would like to say civilian list, or do you still get priority at a nursing home?
No. So what we do, we
Sorry. I have my human moments where I go, what?
No, we're done with our vaccinations. So now what happens is, yes, people can get on the list if they go to their Walgreens or CVS's or the hospitals. But what's coming out is just the second step for the long-term care, where they're actually going to use the pharmacies that are in-house to provide the vaccines, but they haven't firmed up all the plans on that. So I believe it's going to be the Moderna once we get there, but I don't know, with the Johnson & Johnson coming out, if that's going to be an alternative to it.
So you're waiting now for the Fed to firm up its policies to the states to see if you can get put back into maybe a more favored. Okay. I thank you. That just blows my mind, but thank you. Kerry Myers, you had your hand up.
I'm just following up what you said. Does Mr. McClure have any idea if we're going to get instructions from Governor Wolf, or because I know they're about ready to do something with the education system, that whole education system problem is getting handled by somebody else. Can we get into that part of it?
No.
Thank you, Mr. McClure.
What's going to be?
That's going to go down in history as his most concise answer.
Yeah, it's a very good one. But my question is now, where do our people fall in line in this situation now?
That's a great question.
We're waiting for a great answer, I guess, huh?
Yeah, no, I mean, I think Gracedale, I think Jen just answered the question when she said she is preparing our pharmacies to be ready to deliver the vaccine to Gracedale, but our pharmacies have to be greenlit by the feds and by the state in order to do that. And so we have the wherewithal. I think Jen, she's shaking her head. We have the wherewithal to pay for and provide those vaccinations once they are available, but they're not available.
Wait a minute. Am I hearing you correct that we will have to pick up the cost on this and it's not going to be free?
Well, I don't know. They should continue to be free because I think that's the national policy.
Right.
But if they're not going forward into the future, we'll be able to take care of it.
Okay.
Yeah, my understanding I'm getting from this, Kerry, is he's saying from the county end, the minute they say, here's the deal, we can go. We're all sitting around waiting for the Fed and the state at this point.
Well, the pharmacies really.
All right. Well,
Yeah, we got our turn in terms of the state program.
Right.
I guess it's just surprising that our turn. I thought that the state and Fed long-term care facilities, because people are always coming in, and staff in those facilities would always be on an upper tier. I didn't know there was a time frame, and then they sort of get mixed in. But I hear what you're saying. I just was a little bit surprised, not by anything we're doing, but by
Me too.
Okay, I'm sorry. I interrupted Mr. Myers, and then I'll get to you, Kevin. Mr. Myers, go ahead.
Let me just make sure I'm crystal clear then. We're going to be waiting for the Fed to give the pharmacies the okay to come back into Gracedale.
I'll let Jen answer that, but the answer is yes.
Yeah, but the other question for you then, Mr. McClure, before you go, was part two of this.
I thought I was getting out of here.
No, not that quick.
My seat was getting hot.
Is that the same case for the rest of our employees that are scheduled to get it at Gracedale? What about those folks? Like children, youth, seniors, those going into home visitation, things like that. Those that didn't get it. They don't lose their qualification.
So those people who are ambulatory and who can use the phone and the computer and get appointments other places, I think they can still get vaccinated. It's just we're not right now eligible for that same type of CVS clinic that we had. And by the way, I think we might have been one of the first nursing homes in the whole Commonwealth to get it. But the fact of the matter is, the answer is yes. They can still get it if they're eligible. They can still arrange to get it elsewhere, either through St. Luke's or Lehigh Valley or the health bureaus, pharmacies.
Is that for all of our employees?
Yes. Well, the employees who are in the eligible categories right now.
Yeah, because some of them I understand are having difficulties getting probably because there's such a shortage of it. And is there
it's absolutely true, and it's my opinion that we're trying to implement a national policy that we inherited from a failed policy from a previous administration that doesn't work without vaccine to boot.
Okay, so I'm going to shut up after this. So are we putting forth to the rest of our employees who can get it? Is there information being sent out to them how they can get theirs done?
Yes.
Okay. That's all.
Okay.
I'm done. Thank you.
Mr. Lot,
Yes, my question's it's just employees and the residents at Greysdale. I'm not talking about anybody else. So, number one, all employees and residents at our nursing home have that wanted the shot have either completed 2 shots or will complete 2 shots. Is that a correct statement? Anybody that wanted it, worker or residents, has now gotten a shot. So what we're left with was the people that turned down the incentive or did not want the shot. So I'm thinking there's not going to be a big draw right off the get-go because they didn't take the shot when they got an incentive. Am I thinking correctly here?
Correct. We had our one shot to get it.
And those people that didn't get it turned it down, even though we put an incentive. And the residents that didn't get it said they did not want it. And that's correct. So we hit our whole nursing home. Thank you. I just wanted to make sure that everybody that wanted a shot in our nursing home got their shot. And that is a correct statement.
Right. So it's the phase 2 federal program. It's the migration to the vaccine being dispensed by long-term care facilities or pharmacies to our residents, new staff, new residents. So that's the next program. It's phase 2.
And that was my next thing. So really what we're looking at, unless somebody changes their mind, we're looking at new employees and new residents, and that'll work through the pharmacy, correct?
Correct.
Okay, thank you. Now, the other thing I really appreciate, because often we get percentages and numbers, and they don't mean much to me if I don't have them anything to compare them with sometimes. So I really appreciate you putting the CDC's national average of vaccination for long-term care facilities out. And, if our numbers were lower than that, I would be asking you, why did we fail on that? But our numbers are substantially higher than the national average. So I guess I'm congratulate you on your job well done, because we are substantially higher in our residents for giving vaccines, and was substantially higher in our employees. Hard to believe at 48 or 50% was substantially higher, but national average was below 40%. So good job. Whatever we did to, maybe that incentive got us up a little higher than the national average. So, congratulations. And that ends my statement and question. Thank you.
okay. Any other questions? Jen, if you could just clarify something, and thank you, you've been clarifying a lot. If a new resident comes in, to touch on the resident part, and somebody applies, they're accepted at Gracedale. I'm sure they're tested before they come in to see if they have COVID.
Right.
But let's say they don't have it, but they're coming in, and they or the family would like them to be given the shot, or at least started on the 2-phase if it's a 2-phase shot. Is there anything out there? Is there a program or such that people coming into a nursing home that have not been vaccinated, but that want to be vaccinated as residents, that they would be able to get it? Because they'd certainly be in that 65 and over or whatever, but there is no specific thing for them right now.
No, it would be the phase 2. And if we have the ability to maybe sign them up to get them to a regular pharmacy or one of the hospitals we can network with. But as of right now, no.
Okay. All right. Well, thank you. That was just something in my head. All right. Before we say thank you to Jen and move on, are there any other questions? Mr. Kusick.
Yeah, thank you. One quick point. I think while the employees all do sign a contract with regard to mandation, I think they also have a reasonable expectation that the facility will be staffed in a manner that an excessive amount of mandation will not be necessary. So I think that with 250 vacancies, I think that there is some question there. But my other points are this: the vaccination bonus, council never put a time limit on that. So I don't know. I assume we're still going to be compensating people indefinitely, and that's fine. But my real question here is with regard to the Gracedale Advisory Board. I don't recall making appointments to it. I went to the website. It looks like all of the position terms have expired. So I guess my question is the advisory board still meeting? And if so, why aren't the minutes updated, and why hasn't the website indicated their meetings?
They,
Go
they
ahead.
don't, they don't run through us. You know, they are themselves their own, but they have not met. Unfortunately with COVID, that took a lot of meetings offline. So they have not met. So the status right now is unknown.
And let me just say, that was one of the reforms that came out of the potential transfer of ownership, was the establishment of a citizens advisory board. So I'm disappointed to hear that it hasn't met. And I would advise you to work with the administration to re-up that board and get them back involved, because similar to what we have with the jail advisory board, that was the intent of the Gracedale advisory board. And I'm disappointed to hear that it is no longer meeting. They could meet electronically. So thank you for the information.
I do want to say, as far as the COVID vaccine, we had put a stop on that incentive about halfway through. And we found an incentive being that they would not have to quarantine halfway through instead of using the money aspect of it. And we actually feel like we got more people because of that. So instead of quarantining after you got the vaccine, you could come back with just a test result that we could do right at Gracedale.
I'm sorry, John, you finished? Ms. Hefner.
She just answered my question without even having to ask. So like, thank you.
Wonderful. Mr. Myers.
Clarification, I think I have to agree with Lori, because I could have swore at some point we shut off the bonus with that scenario. So, but the other thing I'm a little not quite understanding here is, if we can't get people and mandations happening, what other offer do we have? We're a 24-hour operation.
Right. And we are doing a lot of these hiring incentives that we have never done before. So, I mean, we meet monthly and look at new ways to do it. I mean, it's working, that we're getting people in. I mean, we just got 2 ADONs. We just had 7 new hires. I believe we had 17 in December. So they're coming in. This HR following program is working out, that we meet with them and make sure that everything is going well. So we have so many things that we have in effect. We're just, we're battling unemployment. We're battling so many other things. COVID, changed healthcare.
Yeah.
Well, not only did it change healthcare, it's also changed what we're doing at the Juvenile Justice Center and what we're doing in the prisons and everywhere else. If people could sit back and collect more money than when they're working, they're going to do that. That's only, so we do the best we can. Thank you.
Yeah, and let me just say, I want to say to you, Jen, because we're going to end up having to move on pretty quick to get all this in. I know you're doing the best you can with the staff, and I know the administration and the council, we're doing everything we can. We want to give you all the tools you need to hire more people. But, everybody has to buy in on this, and that includes the staff themselves. And I know you're still struggling with the call-ins and the FLMA. And I mean, I can't really get into that too deeply. That's with you and the administration and the unions. But I've said this before, and I'll say it again. It's important for everyone involved, not just the government officials, but the Gracedale staff, to understand that the success of Gracedale as we go ahead is relying on all of us. And I mean, it is very difficult. We've heard the numbers of the folks who have called off and call off. And I don't know, there's no simple answer for that. But, keep us informed, and we'll do whatever we can, I'm sure, at our end, to give you the tools you need to do your job. And as far as the advisory board goes, I'll look into that. I think President Hefner put me on now, that since she left. So I think. So I will be looking into that and see what I can find out. So
And mandations, we
Yeah.
only mandate for call-offs. We never keep anybody extra just because. We only mandate for those that call off because we need them to care for the residents. It's
Yeah.
the bottom line.
yeah, I understand. Lori, you have both your real hand and your fake hand up, so go ahead.
Thank you. Jen, what would you say to for an incoming staff of any level, from date of hire to fully functioning, orientation on the job? How much time does it take? I mean, obviously that is respective to different levels of staffing, but I know even onboarding with a new healthcare organization, it takes a while before you're really up with the documentation and the recording, because you have to have transfer skills. So what would you say is a reasonable amount of time?
At least 12 weeks to 6 months, if not some of the other jobs, maybe when you talk about ADONs, a good year, because it's ever changing. Every day it's something different that you get thrust into. Even care on the floor, right? You're taking care of different residents. Each one has independent needs. So you have to know, and then when you get transferred from one floor to another floor, every night could be somebody different, a different resident that you have to learn. We have care cards that tell a little bit about a person. It's a snapshot, but you in an 8-hour period get to know that person. So it takes a while.
And as a follow-up to that, and you don't have to answer today. If you want to wait, come back, it's fine. When we're accepting these hires, are we getting really seasoned people with this population coming in? Are we getting some novices who really have to learn the population, or is it a mix of both?
It's a mix. It's a mix. We have people coming in from other facilities who are seasoned. And then we have brand new people who, are a little intimidated coming in because it's they're right out of high school or never even thought to take care of a loved one before, but maybe they took care of their mom and they say, I love doing it. Let me come in and try to do it for other people. So it's all different types.
Thank you.
All right, thank you, Jen. I'm going to end it, I think, there, and we're going to move on to Dr. Van Wert. Thank you very much, Jen.
Thank you.
Hello,
Hi, Paige. How are you?
I'm good, thank you.
All right, so you have a report you want to give us.
I'm going to talk a little bit about monoclonal antibody infusion at Gracedale. I did want to thank Chief McClure for his kind and completely unnecessary words. So monoclonal antibodies are now available for treatment for our patients who have been diagnosed with COVID at Gracedale. Just a little bit about them. They're synthetic antibodies that are made in a lab that mimic actual antibodies against COVID. And as you know, COVID has 2 stages really in its illness. The first one is when the virus itself attacks the body. The second one is when your immune system overreacts, and a lot of fatalities occur during that second phase. So the point of monoclonal antibodies is to infuse them within a certain amount of time from diagnosis, and they actually deactivate the spike proteins of COVID. And if you give it early enough in the course, the data is pointing to a significant reduction in hospitalization and death when these are delivered. So we did our first 5 patients about 2 weeks ago. It went smoothly, and we've now developed a protocol so that we can easily do this through the pharmacy and with an infusion service coming in and overseeing the whole infusion, so it doesn't put a huge burden on Gracedale staff. The 5 patients that we were able to give it to, none of them progressed to any serious stage of COVID. They've all recovered, and none of them had any serious side effects.
Wow, thank you very much. I'm sure there are questions. Anybody have any questions? If not, I appreciate it. Thank you. That was very helpful. Mr. Lott, go right ahead.
First, thank you for bringing this to Gracedale. One of my questions is this something that's typically brought into long-term facilities, or are we kind of unique in being able to administer this in Gracedale. My other question is, and you didn't touch on it, and I don't know if this is appropriate at this time, but we've always had problems with psychological drugs being high, given out a lot at our facility. And that always seemed to be a high number. Why is that? Second question. Yes, I mean,
Okay.
like psychotic drugs that we give out, I kind of know the answer. It was explained to us a while ago, but that always seems to be like the tough number to beat. And it seems like we get graded on that pretty hard. If you could educate me a little on that, I'd greatly appreciate it. Thank you.
Go ahead.
Sure. So to your first point, the use of monoclonal antibodies in nursing homes is fairly new. I go to a number of different nursing homes, and only a few of them have been able to roll it out. And usually they're private, well-funded entities that have a surplus of nursing care. So I think considering Gracedale's overall status as a public nursing home, it's probably on the vanguard of using monoclonal antibodies. To your second point with antipsychotic use, that's squarely on my shoulders. I am the one who orders all of the medicines. So the reason that we have a higher perhaps rate than other places is other places that are private entities get to refuse whoever they want to. And one of the main drags on employees in nursing homes is behaviors. And so many private entities do not want to add to any of their nursing challenges, and they refuse patients who have behavioral issues. Most of those patients with behavioral issues were started on antipsychotics out in the community. And so when someone is in the hospital and needs placement, they're going to be refused by most nursing homes. And Gracedale is that last safety net for our citizens. And so we do take a disproportionate number of patients who are on antipsychotics. But at the end of the day, it's up to me whether or not those antipsychotics can be reduced and if they're still appropriate. So every single time I see a patient or anyone on my team or any of the other physicians at Gracedale, we look and see, is it time for us to try and take that down? And the balancing act that you say is this going to cause suffering for this patient? And that is always, our justification for not reducing it. If that's the case, that we decide not to reduce it, it's because it would cause suffering to this patient or grave danger or harm to themselves or other people. But mostly it's because of our safety net position in the community that we are dealing with the people that the other nursing homes just do not want to deal with.
Thank you. That's good explanation. And I guess I nailed it with asking you that question.
Ms. Vargo Hefner.
Hi, thank you again for reaching out and doing this. How long does the actual infusion process take for a patient?
When we started it, the guideline was an hour, but we had to use much smaller IVs, so it took us a bit longer. It took me more like I was there for the infusion. I did the vital sign monitoring. We took care of the whole thing, and it took a long time. It took about 2 hours, but the FDA has recently put out, or I don't know if it's FDA or CDC, put out new guidelines that you can actually infuse it now in under 15 minutes. So with the appropriate access, I think the infusion companies are going to probably speed that process up. And then it requires an hour of monitoring after the infusion, every 15 minutes, looking for any untoward side effects, fever, nausea, vomiting, tremors, stuff like that.
And are the patients tolerating the process fairly well, would you say?
Yes, I would. One of the patients I was really worried was going to pull out her IV because you have to have established access before you can even order it from pharmacy, and just to get it up here and to warm it up and all that stuff. And she tolerated it just fine. They all did.
And then a second question, unrelated, but are there certain health profiles that are still more at risk? Because obviously we've come a long way in a year. But are there certain comorbidities that are still much higher at risk or
Yes.
Will need this more than others?
So the one study that we're relying on a lot from the New England Journal of Medicine published it on January 20th. They did 500 volunteers with some matched cohorts. And at the end of the day, they were really looking at reduction in viral load as the end result, but they also took a look at clinical outcomes. And they found that of all comers of this 500-person cohort who were matched with placebo controls, it was double-blinded, that 1% of, I think it was 1.6% of all of the patients who they infused required hospitalization, while 6% in the placebo cohort required it. However, if you drew out the high-risk categories of being age over 65 and or having obesity, then the benefit of this infusion was much better, more rigorous. 6% of the people who got the infusion with those two characteristics required hospitalization, but almost 15% of the placebo controls required hospitalization, showing that there was a real benefit to this infusion. But it has to be done early on. These people were all given it within 4 days of diagnosis. You can give it up to 10 days after diagnosis. And it's administratively it is a burden to get it done, but we've got those pathways ironed out now, so it shouldn't be so tough.
That's great. And my last question, because Kevin brought up the antipsychotics, and you, what do they include benzos and other kinds of calming medicines in that antipsychotic category or is it just specifically mental health, true antipsychotic meds, or do they use depression, anxiety, lithium, all of it? Are they all encompassed in that category when they're doing a review?
Well, I think I would have to defer some of that to the administration in terms of how it's statistically analyzed, but none of those things are considered antipsychotics. Those are called hypnotic sedatives.
Right.
But I think they're everything, soporifics, hypnotic sedatives, antipsychotics, antidepressants, they're all measured. And you're graded based on the measures of all those categories. But the ones that seem to have particular harm in our patients are the antipsychotics, because they were traditionally used a long time ago, but it still lingers out in the community for people who have some dementia and some behavioral issues and can't sleep at night and their families are having a hard time. This is what the doctors reached for. And so they come to us on these medications, and they have very bad side effect profiles of increased death, heart attack, strokes. So we immediately try to reduce the dose as soon as we possibly can in those situations.
Thank you. Thank you so much for all you've done.
All right. Are there any other questions for Dr. Van Wert? Because if not, I want to thank her very much. Thank you for what you brought to Gracedale and what you're doing. And we really appreciate all your efforts. Thank you.
You're welcome.
Thank you.
You're welcome. Thank you.
You're welcome. Thank you. Now we have a report from the Gracedale Volunteer Coordinator.
Hi, everyone. For those who I haven't met yet, my name is Jenny Repsher. I'm the volunteer coordinator at Gracedale. And I was asked to come here and just share some of the fun things we've been doing this past year during the pandemic to help raise the spirits of the residents and the staff. So back in May, we were able to do a really cool Motorcade of Support, where it started with a volunteer reaching out to me who asked if we could do something like that around the facility. So I had about, 30 or 40 volunteers, and a bunch of police departments and fire departments showed up, the sheriff's department, the emergency management department, and they had on flashing lights, and the volunteers decorated their cars and they drove around the building. And it was a really, really cool experience. And then after that, the Jeep enthusiasts of Eastern PA also did a parade around the building. We had 50 Jeeps. Some of them are really decked out, and it was really neat to see that. Another really fun event we did, we have the Cool Trees ice cream truck come about once a month when the weather's nice outside. And we were able to block off the front parking lot. We had the ice cream truck there. We got the Peeps Mobile to come, and we had a DJ come, and the staff and residents could go outside. They could purchase ice cream. They could get pictures taken with the Peeps Mobile. We had the DJ there. We had chairs set up all spaced apart. Residents were dancing in the parking lot. It was such a fun time. More recently, I had the Nazareth High School Key Club come in. Well, not in, but they built snowmen outside of the windows for the residents to see. So that was cool to see some younger faces at the facility, to have people that were different that the residents could see. And they did the snowmen, they had like families. They stacked snow so it looked like a rock sculpture. It was really, really neat. And our activities departments have been really cool videoing all of this stuff. So if residents are in rooms where they can't see it, they'll show it over in-house TV system so residents can all see that. Another thing that's been really important to us is when we have enough units that are green, we open the gift shop for the residents. So it gives them a place to go. They can buy some snacks, a little interaction with me and my secretary who keep it running for them. Another thing we've been getting a ton of is donations. So in the beginning, we got donations of PPE. We got homemade face masks. We got face shields, a bunch of hand sanitizer. We had groups dropping off meals for the staff, snacks, candy. And we still once in a while get some snacks or other treats for the staff. So it's nice to be able to distribute that and bring a smile to their faces. Christmas time, it was really important to me to make Christmas and the whole holiday season the same for the residents as it's been in the past. So I had staff help decorate all the trees throughout the facility. I think we had about 30 trees up this year. We received tons of donations from the community, even through the pandemic. I'm just thrilled that they still send all the activity books that they send. We had the Friends of Gracedale Foundation purchase a blanket for each resident, and activity staff helped wrap everything instead of having volunteers come in and wrap everything. So it was really cool for everything to go together without a hitch for Christmas for the residents. And upcoming, I have an Eagle Scout project in the works where they're going to build a permanent cornhole structure in the gardens. And like what Jen mentioned, we had 21 volunteers get fully vaccinated. So we're super excited for when they'll be able to come in and visit one-on-one with the residents and just provide extra stimulation to them.
Thank you. Thank you. Are there any questions for Ms. Repsher? I guess I have a quick question. Has this year been extremely challenging regarding the past year, I should say, volunteers in general?
Well, we haven't had volunteers in the building. Like March 11th will mark a year since we've had volunteers in the building. So that's why we've been trying to keep busy doing other things because we're obviously not managing volunteers. I have had high school students reach out regarding community service hours. So I do have them sending in cards, and we've received literally thousands of cards for residents and for staff. So I earmark, I note which floors got cards so that way I can make sure I distribute them equitably amongst the different nursing units. So then that's one way that I can at least allow high school students to earn community service hours because some schools require that for graduation.
Okay. Have you had inquiries though from other than the students? Even I know they can't come in, but inquiries from people in general?
Yes, I have had several people reach out with interest to volunteer. And I explained to them that due to the pandemic, and we have to follow the Department of Health guidelines, that volunteers are not permitted in the facility. But I will reach out to them. I save all their information so that way I can reach out to them and onboard them when I'm permitted to do so.
Great. All right. Thank you.
You're welcome.
I don't see any hands, fake or otherwise. So if there's no question, thank you very much.
Thank you.
All right. Now we have a little bit of time left for the Director of Human Services. And I guess I would say if you have whatever reports you have, if there's something that's really jumped out or, if you can give us a summation, that would be great. So Ms. Wondolowski, it's yours.
I only have two things tonight, Mr. Heckman, keeping on your schedule. And both have to do with bringing more money in. So those are both good things. So our drug and alcohol division, as you guys know, Beth Miller was here, I think it was just last month, and talked about some new grant money that she got. So the DDAP, the State Department of Drug and Alcohol, is probably once or twice a year reaches out to us to offer additional funding when it is available for additional treatment and any other new bright ideas that Beth and her team might have. And she let me know, just about a week and a half ago, that they were notified that they did get additional funding for MAT treatments. That's the medication assisted treatment that we provide, not our
agency, of course, itself, but with our providers. And she received an additional $620,000. So you've heard Mr. McClure say it last month. Beth is definitely the guru of getting additional funding. So they were thrilled. And so that will just help us, do even more outreach and serve even more folks than we would have otherwise been able to with the pandemic. The second thing is related to, it's called ERAP, because, we need initials for everything. It's Emergency Rental Assistance Program. And it really is going to, at the end of the day, if council chooses to move forward with this, which I think will be coming to finance in a week, 2 weeks, it will be additional funding for emergency rental assistance and utilities. And the utilities include electric, gas, oil, water, trash, sewer, as well as internet. So a few more utilities than the federal funding has permitted. So the money that DCD has talked about and Robin Barbosa is for the CMED program, that is federal dollars. The money that's going to be funneling through the Department of Human Services are state dollars. So because Northampton County has more than 200,000 residents, we are a direct allocation county. And I thought maybe we were getting a few $100,000, but we found out just a few days ago that our allocation, if we choose to accept it, is $10.8 million. Yeah. So it's crazy. I mean, that's really all I can say. So it can only be spent still on those certain criteria in terms of rentals. So it's not for mortgages yet and the utilities. But with this kind of money, we will significantly ramp up our marketing efforts to try to ensure that every person in Northampton County who needs rental or utility assistance and who meets the income qualifications can get it. And essentially, we're still looking at the low to moderate income folks, but I think the magic number is 80%. Their income has to be no more than 80% of the median area income. So that's, and I don't know what that, I don't have that number in. There are various numbers, right? If you're a single person, if you have a household of 1, 2, 3, 4, 5, and so on and so forth, that number goes up. So it still should allow us to help a very large number of people. So I just wanted to briefly mention that will be coming to the Finance Committee for formal introduction and discussion. But I wanted to just kind of give everybody a heads up today about it.
Is there more you have to report before I open it up? Because your department, as you know, always gets questions. So,
we do. No, that's it for tonight.
Looks like she's anxious to ask you a question, so go right ahead.
She already answered one because everybody's just pulling them out. So you said 80% of the median income?
No more than 80% of the area median income. So if that number is $60,000, you can't be more than 80% of that. But it depends how many people are in your household.
Right. And the other question I had was regarding the MAT treatment. So how does that get dispersed? Is Beth just going to hand it out to the agencies that we're already contracted with that are doing that? Or do they have to apply to her to get some of those dollars?
She will reach out to the providers that we already have. And if there are new providers, she would do that as well. They do not have to apply. That will be a more informal process of just pretty much amending our existing contracts to provide additional funding to be able to serve more folks for a longer period of time.
Very good news. And do you have any updates on the New Zealand project? I can't think of.
Yes. Yes. I don't have anything significant. I can tell you in the interest of time, we are making forward progress and the ball continues to roll. So
thank you.
All right, I think Mr. Myers had a question, so I'll get him next, and then someone else has one. Mr. Myers.
Can you give me a number of what we're possibly doing now with DCC with the rental? Do we have any action going on at this point?
Oh yes, I think Robin just reported on that it feels like it was only last week. Maybe it was 2 weeks ago, maybe. So yes, that is an active program that has continued. It started out with PHFA funding and continuing through that $9 million allocation that DCED got.
Okay, if someone calls our switchboard, will they get directed to somebody if that's the way to go?
Sure. So they'll end up getting, like, if they would call our main number, they'll get kicked to the Iris division as always. And then those folks, ultimately, we will, depending upon where they live, they get referred to one of the 4 agency providers that we use to manage the program in order to assist folks with completing applications and collecting paperwork. That's not something we could handle capacity-wise internally. So the 4 agencies we use are all broken down by geographical area and have been doing a fantastic job helping our folks.
Are we using the Eastern Neighborhood Center for local folks?
Easton Area Neighborhood Center, Project of Easton, New Bethany, and 3rd Street Alliance.
You just answered all of my questions. Thank you so much.
You're welcome.
Are there any other questions for Ms. Wondolowski? Ms. McGee?
The money, can you hear me okay? The money coming in, are they looking at, do they take a look at the veterans as well, or is it just income only for?
Veteran status, Mr. McGee?
Yeah,
Is that what you said? Well, it's so regardless of whether or not you're a veteran, the income threshold is the same, but certainly I think the criteria in terms of prioritizing folks, fall with, I think, families with children, single women with children, and then veterans, elderly, disabled. But honestly, with the amount of money that we have, we're not turning anybody away.
I was just curious on how that would go. That's interesting. Okay, thanks.
Sure.
Any other questions? If not, I'm going to thank you, Ms. Wondolowski.
Thank
And
you.
if that's all, then we're going to adjourn. So thank you all.
Thank you.
Take care.
Jeff Ward has his hand up.
Who has their hand up?
Jeff Ward.
Jeff
That was
Ward
a
has
mistake. Please
Oh.
disregard.
Oh,
Yeah.
Wow, the media. All right, no, okay, thank you. We're adjourned.